The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, and I'm here with another edition of the Genuine Article discussing some interesting paper that we either have recently published or will soon publish in JACC. In this case, a soon-to-be-published paper. And surely one of the most important controversies in cardiology at the moment is the role of percutaneous intervention, angioplasty and stents, in patients with stable angina pectoris. And the recent COURAGE trial, of course, which was very well done in a large group of patients, found that, in fact, medical therapy was roughly the equivalent of percutaneous intervention in patients with stable angina pectoris, and that in terms of a survival benefit, it was a reasonable strategy to delay intervention until symptoms were really very marked. Now, many thought that this question was settled by COURAGE, but clearly there remains a great deal of controversy. There are limitations to any study, and of course there were limitations in the COURAGE trial, including the percentage of patients who were screened, who were actually entered, and the percentage of crossovers, and whether or not such intensive medical therapy was really practical in a day-to-day clinical setting. Now, in that breach, we have an article that will appear in a forthcoming issue of JACC that addresses the question of the role of PCI in patients with stable angina by meta-analysis. This study evaluates 17 individual randomized clinical trials in whom patients with stable angina pectoris and signs or symptoms of ischemia were enrolled. And this is a very large study. It's done by Dr. Schomig and associates from Europe, and ultimately included over 7,000 patients. So these 7,000 patients were randomized either to medical therapy or generally to intensive medical therapy with percutaneous coronary intervention, or, as we'll say in a moment, in some cases, to coronary artery bypass surgery. So that it was, as in all meta-analysis studies, characterized by a large enough group of patients so that even a condition with a relatively good prognosis, such as stable angina, could be evaluated for the efficacy of various therapies in terms of a mortality benefit. And the finding was relatively straightforward. In this meta-analysis, what these investigators report is a 20% reduction in overall mortality in the stable angina patients who underwent percutaneous coronary intervention. So here in this meta-analysis, one could look at it and say this represents really an alternate viewpoint to the results of the COURAGE trial. Now, there are a number of issues with this paper that are important to consider. As with all meta-analyses, as we've discussed in the past, the results are critically dependent upon which studies are included or excluded. And it's a bit controversial that Dr. Schomig and his colleagues included 4 studies in which patients were in the relatively recent period following an acute myocardial infarction, because there is general consensus that PCI is clearly the best therapy in patients with ACS or unstable angina. They also included 4 trials in which some of the patients, up to 40%, received CABG rather than PCI, and so that this is obviously, in those cases, not a clear-cut comparison between medical therapy and percutaneous intervention. They also excluded 2 clinical trials which discuss patients with total coronary occlusions, and that's considered a little bit controversial. In an accompanying editorial to this paper, Dr. Bob O'Rourke, who was one of the major co-investigators of the COURAGE trial, indicates that there are a number of other limitations. The methods to evaluate ischemia and coronary anatomy really are not described very well. It's unclear exactly what constituted aggressive medical therapy in all of these studies. There are fairly wide confidence intervals in terms of the odds ratio for death in the individual studies. And of course, as with any meta-analysis, there's heterogeneity in terms of the length of the study and the patients enrolled. So what can we conclude from this? Well, as the editor of JACC, what I conclude is that controversy continues in terms of what the exact role of PCI is in patients with stable coronary artery disease. For the time being, I think clearly the data points to the primacy of intensive medical therapy in these patients with intervention, either PCI or surgery, probably predicated on symptoms or the appearance of an ACS. However, meta-analyses such as these data by Shomig, limited though they be, do raise the question that if a large enough clinical trial was conducted in patients with stable angina who have generally good prognosis, that in fact PCI may well be able to be demonstrated to have a survival benefit. So perhaps an open mind should be kept in the future. Because clearly one thing is for sure, both interventional and medical therapies for stable angina pectoris will surely improve. For the Genuine article, I'm Tony DeMaria.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.